Yep. We started going to Haiti at the beginning of 2007. It was through the University of Notre Dame Haiti program. And basically what it involves is treating people who suffer from lymphatic filariasis. Lymphatic filariasis is a parasitic disease, mosquito-borne, related to dirt and garbage. It is a microfilaria, a very small 4 millimeter worm that is passed by the mosquito into the human, and then it grows within the human. And what it ends up doing is blocking off lymphatic flow. Lymphatic flow is sort of the edema fluid that will develop in your lower and upper extremities over time. If it blocks that flow, then you get this huge swelling over time, and it's not everyone that gets the disease. There's surely many Haitians who have a high worm titer, millions, and never develop the lymphatic filariasis, or the elephantiasis, which is the gross swelling of the limbs. So there's only about maybe 5% of people that develop the true elephantiasis, which all of you have seen pictures of, hugely swollen legs most of the time. It can happen in upper extremities as well, and in women it can happen with breasts. So what we're trying to do down there is we're trying to treat the manifestations of that disease, and the one thing I didn't mention, which is the scrotal swelling in men. And the scrotal swelling in men, again, is due to lymphatic flow blockage. They can get huge scrotal swelling even below their knees, down to their ankles. It's significantly limiting for them as far as activities. It is something that they are ostracized for in the Haitian society. They really are laughed at and ridiculed because of it. So our goal is to surgically help those people, and it's by draining the hydrogel fluid and reducing the size of the skin of the scrotal sac. And so there are many men who have these huge swollen scrotum below the knees, maybe 50 of them in the country. But there are many more who have the smaller swelling, probably a couple 100,000, and we're dealing with both those groups, trying to eliminate that manifestation of the disease. Notre Dame is also working with so that's the surgical arm. The medical arm is mass drug administration. There is a drug, diethylcarbamazine, that will kill the worm. And if you can get that out to the population in general, one dose once a year for 7 years, you will eliminate lymphatic filariasis in Haiti. The problem is getting people to take that drug and getting it distributed. First of all, getting it distributed to everyone. Then once it gets to everybody, having people take the drug. Because what they experience when they take the drug, if they have a high worm titer already, severe muscle aches, nausea, vomiting. It really is difficult for them to accept the fact that they're taking this medicine when they feel fine and they make themselves sick. The point of this is that once they get rid of that high worm titer, when they take the drug the next year, the side effects aren't nearly as bad. But that's the only way you're going to get rid of the disease.